Hi, I'm Abigail Wilpers. I am an assistant professor at the University of Pennsylvania School of Nursing and a health services researcher here at the Children's Hospital of Philadelphia.
My name is Simran. I am the membership coordinator at SisterSong Women of Color Reproductive Justice Collective. So Abby reached out to me 2 years ago, I want to say, and she is a member of SisterSong, and she reached out looking for kind of a reproductive justice lens to be able to be applied to fetal conditions work that she was doing. And I did not know anything about fetal conditions or high-risk pregnancies, but I've been in this reproductive justice space for a long time. And so we wanted to really combine our expertise and be able to build something that looked at specifically communities of color that were having fetal condition diagnoses at just the same rate as anybody else. So we did a larger focus group with the SisterSong network and had a great turnout. A bunch of people come through and they were telling us about their experiences, and it was really jarring to hear how for people who had worse insurance, who had less access to resources, who were from poor communities, they did not feel like they had the options that were equitable or medically accurate to be able to access when they were finding out about their fetal condition diagnosis. They felt pressured into certain positions, different depending on the laws of each state. And so we wanted to do some research that was really specific to these communities to be able to tell their stories.
Yeah, we actually had a big win. We had our first paper accepted for publication, and it's essentially the framework of reproductive justice with case examples applied for folks who have had a variety of fetal conditions. So I think it really serves as a good roadmap for us and as a way to inform the study itself. The question is only answerable by the people who experienced it. Working with community partners keeps you grounded. It makes sure that you're thinking about things from an ethical standpoint, from a perspective that you can't personally share necessarily. And so what you bring are things like you're the methodologist, you're somebody who has access to resources to be able to do research, but that there are lines around that, and that your expertise ends where your partner's begins, really, and that's a really important part of that collaboration.
Actually being able to foster those community connections is how we create good, thoughtful research that is primarily hitting the people who are most impacted by these experiences. And so I think from an ethical perspective, there's that. But I also just think like it fundamentally makes better research. And I think that that is the thing that people are missing out. At the end of the day, it's just better research. Like you're going to get better answers. You're going to get more answers to the questions that you're trying to ask. And yeah, it's more rigorous. And so not avoiding that. I also think like you said with the resources and piece too, like so many community partners want to know more about our communities. We want this information and we don't have access to the kinds of methodologies or resources to be able to make that happen. So being able to understand our communities better is such a wonderful part of being involved in research projects.
Oh man, I mean, well, this wouldn't be happening without Policy Lab and without this specific kind of grant mechanism. Being able to have the funding to really compensate our participants, compensate our advisory board, and be able to support things like training for folks in the community partnership, being able to have them come here to Philly, getting the support for that. And then really also we ended up working with Top Qualitative Research Corps through Policy Lab. And so they're providing additional methodological infrastructure.
I got the opportunity to learn and be trained on how to do qualitative interviews, which is not something that I may have otherwise been able to access as a community organizer. And now I have this whole new skill, which I think is such a gift. In that, I think that Policy Lab has really given me an opportunity to not just grow our partnership on this project specifically, but to grow our partnership connections and knowledge that will help this work more broadly. I'd also say that it really feels like Policy Lab cares what we think. Like we get to have the opportunities to come and join together with the other grantees who are doing such amazing work and talk about the work that all of us are doing, and then give feedback. So this has been a very refreshing way to see that maybe there's a way to do it differently. Do it.
I know it's good.
Come up with more than do it, Abby.
I enjoyed putting the proposal together, which is something I don't think I can ever say about any other study. Like it was an enjoyable process to figure out how do we apply for this grant and make ourselves competitive and rise to the challenge. So yeah, and the fact that it's 2 years is really great. I think a lot of pilots, they give you 1 year and that's just not enough for research. So these 2 years, it's a real opportunity to take the time you need to do it right.